I want to talk to you a little bit about nursing sensitive quality indicators and talk specifically about central line associated infections as an outcome based indicator. So let's start with this. What is the National Database of Nursing Sensitive Quality Indicators? So this was developed by the American Nurses Association. It's basically a database of over 1,100 hospitals are contributing to this database that publishes annual reports on structure, process, and outcome related measures of how the nursing practice influences patient experience. That definition is from the ANA website. So what are nursing sensitive quality indicators? The Agency for Healthcare Research and Quality, they define structure, process, and outcome as the three cornerstones of quality indicators. So structure is what it sounds like. It's the whole system, and it basically deals with the capacity of the healthcare system. One example that the Agency for Healthcare Research and Quality describes is staffing ratios. That would be a structure-based indicator because it is showing the capacity of the structure of the system to provide better patient care. So we see that better staffing ratios, so more nurses creates better patient outcomes. That would be a structure. Process is where we indicate things that we're doing to maintain or improve health, and this would be stuff like primary care screening, imaging, stuff like that. And then outcome indicators would be specific interventions that we're doing that are related to a patient result. Lots of the examples that the Agency for Healthcare Research and Quality give are related to like rates of infection, rates of surgical complications. Those would be outcome based, and we'll talk more about an outcome based one here in a second. So the quality indicator that we're going to address is, again, the catheter associated infection, specifically the central line infections. Why is this an important one to monitor? Because the CDC website says that thousands of deaths each year occur because of this, and that it costs the U.S. Health system billions of dollars. So high cost with patients' lives. The CDC says that most of these occur in PICC lines, so peripherally inserted catheters, or central ports. This is important because it's also preventable with regular nursing care and proper insertion, and being mindful about removal, and it's costly. So those are things that are important about it. I talked with our nurse manager about these kind of indicators, and they said that nurses need to be familiar with this indicator because we use these lines a lot on our unit. And more so, nurses, we physically interact with these devices all the time. So we have a major hand in the issue. So our organization collects data on this via our clinical nurse specialist. So she looks at our charting and she sees, are we doing the proper catheter cares? Are we addressing the dressings of these catheters? And then if we are having infections, she's backtracking the charting to see, is there an association between, this kind of charting or lack thereof, in regards to these infections. So that's how we would collect the data, and that would come a lot from our clinical nurse specialist. So how do we disseminate, how do we communicate this data? So oftentimes this will come through emails, which is at Mayo Clinic the primary communication. So we'll send email updates about trends that we're seeing. Also, we have a monthly cardiology newsletter where all the cardiology units are posting updates on outcomes, patient-related information. So those are a couple of ways that we, as an organization, disseminate our data from these things. So what role do you as nurses play in accurate reporting and getting high quality results? So things that you can do as new nurses are, listening to your preceptors when they're going through what kind of care is expected with these central lines. For me personally, on my unit, these are twice a day assessments that are documented, where we're documenting the site assessment and the dressing assessment. Making sure that we're documenting why we have this catheter. In our EPIC flow sheet, it talks about necessity of line, and it'll have a bunch of options. Are they using it for lab draws? Are they using it for chemotherapy? Are they going to use it at home for antibiotic infusion? We need to be charting why this patient has a catheter, and if they don't have a proper reason listed, then we need to be coordinating with our providers about removal. And again, just want to reiterate, these catheters are part of our twice a day assessment, our normal assessment. So just documenting what you're seeing, is it red? Is it inflamed? Are we having any problems with it? So the importance of having accurate data is because it's an input, output, and a subsequent intervention kind of procedure. So the data, if we're collecting data that's not fully correct or is not enough, not sufficient, then our output, so if our input is wrong, then our output is going to be wrong, okay? And then if we're making interventions and best practices based off of our outputs from these studies, if our outputs are incorrect, then our interventions aren't going to be fully correct. If we're not accurately reporting these infections, we're not going to have an accurate response. Our response might not be big enough, quick enough, or prioritized enough. So it's really important that we as nurses are documenting our assessments, documenting changes, and really just giving our clinical nurse specialists the ammunition they need to kind of conjure up these best practices based on what we're seeing in the clinical practice. I just want to close by offering some of the central line best practice, specifically from Johns Hopkins Medicine website. So I touched on some of this before, but it's imperative that we remove the catheter as soon as we don't need it anymore, making sure that every day we're assessing if we have criteria that's met for having this line. Are we doing chemotherapy? Are we going home with this? Are we using it for labs because we can't get peripheral access? Those are the kind of things we need to be considering each day, because we know that having no catheter would be better than having a catheter, all things being equal. Johns Hopkins also recommends having placement kits that have all the sterile procedures in one spot, so you're not having to go and gather different items for sterile procedure. You probably, if you're working at my place, will not be inserting these lines, but it is important to know that we have these kits available that have all the stuff that you need. And then again, we touched on this, but Johns Hopkins wants to reiterate the routine monitoring of the site and the dressings. Is it peeling off? Is it off entirely? Is it red? Is it painful? Is it inflamed? Are we having fevers? Just general monitoring that you're going to do as a nurse. So these are some of the things that we consider as far as quality indicators, specifically with the outcome-based quality measure of catheter-associated infection, specifically the central lines. Thank you.